Hello, my name is Nora. I am going to be your nurse today. I'm just going to do a quick head and toe assessment. If you can please give me your name and date of birth.
I'm Jenny Smith, July 8, 96.
Okay. And here I want to ensure that the bed is at lowest position, but right now since I'm working with her, it should be at working height. 2 side rails up, working side rail down. I want to identify if she's a falls risk patient. Here I will make sure that the bed alarm is on, non-skid socks, and ID band to identify that she's a falls risk patient. She is not, but if she was, I would make sure I would assess all those areas. Here I'm going to do a quick neuro exam. If you can please tell me the year and date today.
March 28, 18.
Okay, and can you tell me who the current president is?
Trump.
And where are you?
In the hospital.
Here I would note she's alert and oriented ×3. I'm going to assess PERLA, which is pupils equal, round, reactive to light, and accommodation. Here I'm going to have her please take off your glasses. Do you wear any contacts at all?
No.
Okay. Here I'm going to check for PERLA again. Okay. I'm going to assess the patient's mood. How is your mood usually on a daily basis? Right now, do you seem anxious? Are you stressed out at all?
I feel fine.
Okay, very good. I'm going to check your head. When I palpate your head, do you feel any pain?
No.
Here I want to note any inflammation, any discharge. Okay. Do you have any headaches? Do you experience any headaches on a daily basis?
No.
Okay. Here I'm going to have her open up her mouth and I want to assess her mucous membranes. See if there's any lesions, any discharge. Is it pink, moist? Okay. Next, I'm going to have the patient grasp both hands. Can you please grasp my hands as hard as you can? She has equal strength bilaterally. Next, I'm going to dorsey and plantar flex her foot. So if you can please point and flex your foot down. Okay. And if you can please flex and extend both arms. Here I'm assessing for range of motion, and she does have active range of motion and bilaterally. Okay. I am going to assess your heart sounds. Okay. Here I want to check her PMI, which is her apical pulse, which is located at the 5th intercostal space. Okay. And I'm also going to, her apical pulse is 80 beats per minute and her rhythm is regular. I also want to assess her radial pulses and her dorsal pedal pulses and her posterior tibial pulses bilaterally. I also want to assess her skin for warmth, color. Okay. Note her capillary refill is less than 3 seconds. Okay. Her temperature using the back of my hand to see if it's warm. Okay. Next, I am going to assess the patient's respiratory. So I'm going to have the patient sit up for me, please. And if you can take a deep breath in and out. I'm going to check posteriorly as well. And here I'm just going right to left. Okay. Here I want to assess her respiratory effort, if she's in any respiratory distress. Does she have equal lung expansion, use of any accessory muscles? She does not. I'm going to explain to the patient or ask the patient if she has any cough. Do you have any cough?
No.
Okay, but I'm going to ask the patient right now to give a cough for me. If she does have a cough, I would note any secretions, the color, the odor, the clarity, how often does she cough. Okay. Next, I also want to assess to see her oxygen saturation. So I'll get a probe. If I did have a probe, I'll place the sensor on her fingertip. The oxygen saturation should be more than 95%. If it's less than 95%, I will place her on a nasal cannula, 2 to 4 liters at max. Okay. Lay down for me now. I'm going to place the patient in a supine position, and I'm going to assess her gastrointestinal system. I'm going to have the patient place her arms at the sides, and I'm going to note and inspect any symmetry, if it's bulging masses, any bulging masses. I want to make sure that the pillow is behind her. Okay. I'm going to also go at the foot of the bed, and I have the patient take a deep breath in for me, and I want to note if there's any change in symmetry. If it's asymmetric, right now it's symmetrical. Okay. I'm going to ask the patient, how is your bowel movements on a daily basis? Is it normal? Do you have diarrhea?
It's normal.
And how often do you go?
About once a day.
About once a day. Okay. And what's your diet usually like?
Fairly balanced.
Okay, very good. I want to also, now I'm going to auscultate the bowel sounds, all 4 quadrants, starting at the right lower quadrant first. Okay, bowel sounds are active at all 4 quadrants. Next, I am going to palpate for any distension, any rebound tenderness. Do you have any pain while I'm doing this?
No.
Okay, very good. So I'm going to have the patient sit up once again, and I'm going to check her genitourinary system. If she did have a Foley catheter in, I want to note that the flow is drains by gravity. I want to note if there's any kinks in the tubing. I want to note the volume of the urine. Output should be more than 30 milliliters per hour. Note the clarity, the color, is there any odor. Ask the patient, do you have any pain while urinating at all?
No.
Any hesitancy while urinating?
No.
Okay, and what's the color of your urine usually like on a daily basis?
Clear.
Okay, and do you experience any incontinence? What that means is, do you experience any spontaneous urination? Do you usually go to the bathroom before, like on yourself at all?
No.
Okay, very good. Okay, next I'm going to assess her skin. I want to assess the skin turgor. Okay, I want to note any drainage, if she has any drainages at all. Skin turgor I should assess. It's non-tenting. She has no drainages. If she does, I want to assess to see if there's any Jackson-Pratt drainages, the volume of the drainage, the color of it. I want to assess for any lesions, abrasions, the color, lacerations. I'm going to have the patient sit up for me. And I want to note to see if she has any pressure ulcers in the sacral area, if she has any erythema. If she does have erythema, I want to note if it's blanching or non-blanching. Note her joints or elbows, if she has any ulcers, abrasions, redness, or anything like that. Okay. I'm going to have the patient lay back down for me. Okay, I want to assess her IV site as well, if she has an IV going. Okay, note redness, phlebitis, any infiltration. Okay, she doesn't have anything going on. And before I leave, I am going to keep the bed at lowest position, 2 side rails up, and call bell within reach.